Good evening. Andhra Pradesh Chief Minister Chandrababu Naidu's decision to reward parents rupees 30,000 for a third child and 40,000 for a fourth child, I'm afraid is fundamentally illogical and carries serious catastrophic demographic risks. It must be rejected. Here are 7 reasons why, very briefly. Number 1, it is parochial, regional and xenophobic in nature. In thinking of Andhra before India, Mr. Naidu does India and Indians great disservice. We should be thinking of India's total fertility rate, not Andhra's or any state's or any city's total fertility rate. What exactly are you vying for? More Andhrites? When any Indian can become an Andhrite. When millions of Biharis are now Maharashtrians. When millions of Gujaratis are now Bengalis. And millions of UPites are now Kannadigas and Tamilians. We should be encouraging mobility of fellow Indians from a state that has high total fertility rate or TFR to states that are worried about low TFR like Andhra. Instead of giving tens of thousands of crores for producing babies that you're calling Andhrites, bring in thousands of Indians from other states and make Andhra a great home for them and make them Andhrites. This policy is therefore anti-India and anti-Indian unity. Number 2, Andhra already is population dense, 329 persons per square meter. But what matters is people per unit of productive, arable, cultivable land, not total land. And that for Andhra is 970 persons per square kilometers of arable land, and that is what matters. And recurring droughts in Rayalaseema, cyclone risks and interstate water dispute Krishna Godavari with Telangana add tremendous stress. More than 62% of Andhra workforce remains in agriculture. So land and water productivity directly affects livelihoods. The high population density is already posing a strain on precious resources. To increase it further by paying for it, I'm sorry, is madness. Number 3, this policy imposes a reckless fiscal burden with poor opportunity cost. Mr. Naidu is committing thousands of crores of taxpayers' money at a time when Andhra Pradesh already struggles with huge debt, infrastructure gaps and underfunded essential services. Andhra has a high debt to GDP ratio of 36%. Each additional child will require decades of state spending on schools, healthcare, nutrition and eventual job creation, far exceeding the payout. This diverts scarce taxpayer resources away from high impact investment like skilling the existing youth workforce, improving healthcare access or building industrial corridors that could genuinely drive growth. It is akin to treating a symptom, which is low birth numbers, while ignoring the disease, structural underdevelopment, making the policy economically irrational and disastrous. Number 4, it fails to address the real drivers of declining fertility. Andhra Pradesh's total fertility rate has fallen to around 1.5 to 1.7, primarily because of urbanization, rising female education and workforce participation, escalating costs of quality child rearing, education, housing, healthcare now run into lakhs per child, and aspirational smaller families. A one-off cash transfer, therefore, does nothing to lower these structural barriers. Parents know 40,000 rupees barely covers a fraction of the cost of rearing a child for 2 decades. And global evidence from Japan, South Korea and parts of Europe shows similar financial incentives have produced only very marginal temporary fertility bumps before reverting to the trend. The policy is therefore a gimmick rather than an evidence-based solution, wasting political capital on something that cannot sustainably reverse deep socio-economic shifts. Now the other problem, which is it heightens demographic danger by accelerating resource strain in an already overstretched state. That's point number 5. Did you know Andhra faces acute water scarcity? I've already said shrinking arable land, groundwater depletion, climate vulnerability. Pushing families towards 4 children will increase pressure on finite resources, more mouths to feed amid stagnant agricultural productivity, higher urban congestion and greater environmental degradation. With Andhra's youth joblessness a persistent issue and is very high right now, this risks creating a larger youth bulge without corresponding employment opportunities, potentially leading to social unrest, migration crisis and long-term dependency ratios that collapse under their own weight. Demographically, this is the opposite of prudent stewardship. It trades short-term more bodies for long-term ecological and economical peril. Number 6, it risks perpetuating cycles of poverty. Financial incentives of this nature tend to disproportionately attract lower income households who may view the cash as immediate relief, but lack of capacity to invest in quality upbringing for additional children. The result is larger families with lower per child investment in education, nutrition and skills. Precisely the opposite of the demographic dividend southern India has enjoyed through smaller, better educated cohorts. Instead of building a high productivity workforce capable of competing globally, the policy could swell the ranks of low-skilled, non-skilled, undernourished citizens dependent on future welfare. So logically, this inverts the proven development model. Quality over quantity in human capital is what drives prosperity, not raw population numbers. India needs a healthier, wealthier, wiser, more flexible, more adaptive workforce. Number 7, it ignores long-term demographic imbalances. Now, Andhra achieved replacement level fertility even less than that through empowerment and awareness, leading to a balanced age structure and reduced pressure on public systems. Reversing this course selectively could distort sex ratios if son preferences persist, and they do in Andhra, and create uneven generational cohorts that destabilize everything from school enrollment to pension system 20 to 30 years. Also, because we do not have a uniform civil code, and because a man can have 4 legal wives, he will now be paid by the state to potentially have 16 children, and all to be cared for by the state till they turn adults, and even after that. Do you have any idea what this will do to the demography of the state? We already have a community whose leaders have publicly expressed their desire to overwhelm a nation through their population strength. And this is already happening in Europe and other parts of the world. We are therefore looking at another division of India, possibly along religion lines. In summary, the policy is a short-sighted populist move that prioritizes optics over evidence, fiscal prudence, and sustainable demographics. It exchanges today's headline for tomorrow's burdens. It is not going for demographic dividend, it is going for demographic disaster. It must be reversed.